In my session, we've tried to keep things quite practical and very interactive. And I do this by bringing in some case studies about important and common psychiatric complications of Parkinson's disease. So the first case study we talk about involves a person with mild cognitive impairment in Parkinson's disease, and we make the point about how prevalent this is and how it may be a harbinger of dementia in Parkinson's disease and how it can be managed. In our second case, we talk about a patient who's developed psychosis and dementia in late-stage Parkinson's disease, and we address the various aspects to do with the diagnosis, the acute management, and the longer-term management. In particular, the involvement of other agencies to manage what is a highly complex condition, impacting not only on the patient, but also on their carer. In the third case, we address the issue of apathy, which is an area of particular interest because I feel that it's very under-recognized and under-managed in Parkinson's disease. And we talk about how common it is, particularly as cognitive impairment gets worse, and we address various strategies of how this can be managed. We also talk about apathy as a syndrome made of several dimensions, including lack of interest, lack of motivation, and also emotional blunting. And it's important to understand these and tease them apart so that a meaningful discussion with the family can be had and management can follow. And finally, we talk about impulse control disorders. And the example we have is of a younger woman who develops this particular problem in the context of her Parkinsonian medication and a recent increase in her dopamine agonist. And here we discuss the risk factors for developing impulse control disorders, how to manage the acute scenario of somebody potentially being a tremendous risk to themselves and others in the height of an impulse control disorder, and also how we manage the longer-term situation for a person who might be at risk.